Missouri leads the nation in Delta variant cases. 96% of all new cases in the state have been linked to the new strain.
Hardest hit, Springfield, where doctors are scrambling for ventilators and staff, even sending patients back here to KC. The health department just announced 17 people have died here in the last 2 weeks.
We sent our I-team directly to Springfield to learn more. Investigative reporter Angie Racono joins us now live from Cox Medical. Angie, what are you hearing about the COVID patients they're treating there?
We're hearing this new wave. They are younger patients. There are actually 10 patients here in their 20s, and there's also a pediatric patient. We do want to clarify that these younger patients, they aren't the deaths, but of course 17 deaths in 2 weeks, that is very concerning. Doctors are also pointing out that some of these patients had COVID before, but they chose to not get vaccinated, and they're now learning they're susceptible to the Delta variant.
Springfield hospitals are overwhelmed. Cox Medical struggles with staffing. Mercy Hospital is scrounging for ventilators. Both are shipping patients to other hospitals because they are so overwhelmed.
We're very stretched thin.
Staff at Cox Medical mince no words, explaining the crisis will only get worse.
We are having about 18 patients a day show up that need to be admitted. And next week, it looks like we'll have about 24 patients a day showing up that need to be admitted. And 2 weeks from now, it looks like we'll have about 27 patients a day showing up to be admitted.
Frustration is evident. Hospital leaders sum up the situation as scary.
When we look at our census, 115, about 85 of those patients right now are on some kind of mechanical ventilation support. And that's pretty scary.
Hours later, the numbers grew again. We have more than 120 people hospitalized for COVID-19, which is more than triple our COVID inpatient rate from last month and the highest since COVID began. We continue to see mostly people who have not been vaccinated. As of today, out of more than 200 hospitalized, only 3 are fully vaccinated. Doctors emphasize the solution is simple: get vaccinated. This is where Missouri struggles. The statewide vaccination average is below 40%. Springfield is 33.7%. Kansas City is a bit better at 37.4%. St. Louis is 43.6%. It's a sticking point for hospital staff who understood the December and January patients didn't have a choice. They do now.
I think it's a little harder now when the vaccine is widely available. So I think that's making the morale on staff lower than what it was this winter.
So today, libraries were offering vaccinations and only about 50 people showed up. And while that doesn't sound great, the health department says that's actually better than what they normally do see on a daily average. Reporting live in Springfield, Angie Racono, KC TV5 News.
Well, Angie, we know the hospitals need staffing. Do they need nurses? Do they need doctors? What exactly do they need?
They said they need everything. They need people who can come in and do housekeeping, and they're starting to cross-train employees. So if you want overtime when you're working in accounting, you can come in and help with housekeeping and other support staff. But the biggest thing they need are nurses. So if anybody out there is a nurse and they want to be hired, this hospital wants to make it clear they're ready and willing to hire you. Staffing is a huge crunch.
Boy, good to know, though. Angie, thank you. Sounds like a tough situation they're in. Thanks for that report.